Hi, I'm Dr. John Chessare, the President and CEO of the GBMC healthcare system, and I'm here to bring you our bi-weekly update on the pandemic in our country, regionally, and also here at GBMC. So today we have good news. Yesterday, the CDC reported that the number of hospitalized COVID-19 patients across the country has returned to levels that we have not seen since mid-November. Both regionally and at GBMC, that trend continues. In Maryland, we're getting close to the 1,000 number. What I mean by that is we're getting close to having 1,000 or fewer Maryland residents admitted either in regular beds or in the ICU. So stay tuned. The message there is that there is adequate capacity in Maryland hospitals to take care of sick people. The fact that COVID-19 admissions are dropping and that we've had so few influenza admissions makes Maryland hospitals in a good position. Usually in February, Maryland hospitals are all full in their med-surg beds because of respiratory illnesses making people sick. This year, the predominant cause of adults being sick in the hospital due to viral pathogens is COVID-19, but again, the number is dropping. A big question is why? It's probably in part because of immunizing people. It's probably also in part because the weather has been cold, people are not going to work, there have not been very many gatherings, so there has been fewer opportunities for the disease to be transmitted. And finally, thank you, Marylanders, for staying socially distant when you are out and about, wearing your mask, and washing your hands. So all of that is pretty good news. We can't let our guard down. Keep it up. We want to get rid of the pandemic. If we continue to do the big four, staying socially distant, wearing your mask, washing your hands, and getting your vaccine when it is your turn, we will end the pandemic eventually. Let me comment about school attendance. Some of you will recall Dr. Fauci when I interviewed him addressing the issue of school attendance, and he said at that time the decision should be made regionally. The first factor that needed to be in place was the rate of disease in a region needed to get below 5%. The best parameter we have is the test positivity rate. We are now down to roughly 4.1%. So our background rate of disease makes it look like it is safe for children to go back to school. The second thing that needed to be in place, however, was a system for assuring that we adhere to, once again, socially distancing, wearing of masks, and hand hygiene. Another relatively new factor is teachers have been included in Tier 1 in the state of Maryland. They are all eligible to be vaccinated, and school systems that have high rates of teacher vaccination will also have a better chance at safely reopening their schools. So we are grateful to all of our school systems for working hard to educate our students and for applying these scientific concepts as they are making the decision to reopen or not. So again, generally, the message is good. The number of people getting sick enough to make it to the hospital is going down. The test positivity rate is going down. Keep it up. with your hand hygiene, social distancing, wearing of mask, and getting your shot when it is your turn and it is available. If you need us, we are here for you at GBMC. Thank you very much. Be safe.